We are extremely happy to have two expert evaluators with us. Welcome Dr. Kaushik Biswas and Dr. Dhrubajyoti Sarkar. Dr. Kaushik Biswas is an associate professor of pharmacology in Eminent College of Pharmaceutical Technology, Varashat, and Dr. Dhrubajyoti Sarkar is an associate professor in the Department of Pharmaceutical Technology in School of Medical Sciences, Adams University. I hope all the participants already received the respective guidelines. The presenter will get 4 minutes for presenting the e-poster, followed by a brief question answer round for 1 minute. I will be announcing the poster number sequentially along with the presenter name. So keep your poster ready, and I wish you all the very best and all the best wishes for all of you in advance. Thank you. So I would like to call the poster number along with the presenter name. So with the due respect to all the evaluators, so with your kind permission, should I start the session? Dr. Kaushik Biswas and Dr. Dhrubajyoti Sarkar, may I start
Yes,
the
please.
session?
Yes.
Okay. Thank you, sir. So first poster which I would like to call, that is poster number 3, which will be presented by Simran Sultana. Simran, are you here?
Yes, ma'am. Am I audible?
Yes, you are audible. You can now share your poster. After that, I will start your time. Yeah, it's visible now. You can start.
One and all present. I'm Anna from Pharmacy. I'm presenting my pharmacological screening
You are not audible. Some background noises are coming. Uh, yes, you are audible, but your voice is breaking.
Hello.
Yes,
Is it okay now?
yes, completely you are audible. Now you can start. I'll start your time.
Okay. Good morning, everyone. I'm Simran Sultana, Acharya in BM Reddy College of Pharmacy. I'll be presenting my poster on pharmacological screening for anti-Parkinson's activity of allium cepa, haloperidol-induced Parkinsonian rats. Parkinson's disease is a neurodegenerative disorder that is mainly associated with bradykinesia, tremor, and rigidity. It is due to the deficiency of dopamine in the dopaminergic tract, as dopamine is mainly associated with muscle movement and motor coordination. These symptoms are hallmark of Parkinson's disease. Parkinson's disease is also known to induce oxidative stress as an extrapyramidal side effect. There are various medications which have been used as anti-Parkinson's, but they do not give a complete cure. Various plants have been studied for their activity as anti-Parkinson's medications. We have selected the drug that is allium cepa because of its activity as neuroprotective and also other activities like antihypertensive, hypolipidic, nephroprotective, antidiarrheal, and cardioprotective activities. We have selected allium cepa, that is the ethanolic extract of allium cepa, to evaluate its anti-Parkinson's activity. So, in we have selected Wistar albino rats, which are divided into 5 groups, each consisting of 6 animals in each group. Is group 1 negative control, positive control, and test group 1, test group standard. In negative control, we are giving just distilled water. Then positive control, we have induced haloperidol. Then group 3 and group 4 are test group 1, test group, in which we are giving 250 mg per kg and 500 mg per kg of the drug respectively. In standard, we have been given levodopa and carbidopa plus haloperidol. The experiment was for 30 days time, and the haloperidol treatment started on the 17th day of the experiment. That is, it carried out for a total of 4 days. Then after that, the test for motor coordination was every week, the 1st, 7th, and 14th day. And then the animals were sacrificed for the of the brain to carry out the biochemical estimations and histopathological studies. Coming to results, after the haloperidol treatment, we carried out motor coordination tests, that is catalepsy test, rod test, open field test, and actophotometer test. Catalepsy test was all these tests showed significant improvement with both the doses, and higher improvement was seen in the higher dose, that is 500 mg per kg. Coming to the tissue antioxidant parameter, that is the biochemical estimations, here we have performed the test for SE, that is superoxide dismutase, catalase, and glutathione GSH. All these have shown significant improvement in the treatment groups and which were reduced in the positive control group. Our findings are also supported with histopathological studies. Here we have taken a section of cerebral cortex. In the group 1, that is a negative control, we see a normal cerebral cortex with normal cortical neurons. In group 2, we have positive control, that is haloperidol given rats. These have shown degenerated cortical neurons. When coming to group 4, that is test group 1 and test group 2, test group 1 is 250 mg per kg and they have shown mild degeneration. And in group 4, there is mild to normal cortical neurons. When coming to group 5, that is standard, there is no it is shown normal cortical neurons. Apart from this, we have also evaluated the drug for the levels of acetylcholinesterase, myeloperoxidase, and also malondialdehyde, along with total protein content. All have shown improvement, that is higher content. And also, when compared to the lower dose, the higher dose has better improvements when compared to the positive control group. So overall, from our study, we can conclude that IM SEPA shows improvement in Parkinson's.
Okay. So now I would like to request evaluators to ask the question.
Okay, Sultana, ma'am, I just want to ask you one thing, that have you isolated the haloperidol?
Sir?
Have you isolated the haloperidol, or you have done the activity with the extract?
So we have used haloperidol in one group, that is positive control. That extraction of the drug was carried out using methanol only, sir. Methanolic extract we have used.
So in which group you get more activity, haloperidol group or the extract group?
The group, the Parkinson's disease was mainly symptoms were more in the positive control, the untreated group. In the treatment, where we treated with the have shown improvements in motor coordination as well as the biochemical estimation.
Okay.
So, yeah, shall I ask the question?
Yes.
Yeah.
Yes, sir.
Okay. So, what is the basis of selection of the doses? Hello? Yeah.
Seen, from the previous studies, we have seen that they have proved as a neuroprotective activity. We have referred those literature and selected doses.
No, I'm not getting your voice properly.
Hello?
Yeah. Hello. Can you repeat the answer, please?
Based on the studies we have done through for this research, we have selected based on those studies, sir.
Okay. And have you checked the toxicity study previously?
No, sir. In this, we have just referred the literature, sir.
Okay. And according to you, what is the basis of the activity? Means what principle is responsible for the Parkinson, anti-Parkinson activity?
So here, as we can see in biochemical estimations, they have shown improvement. So the oxidative stress is reduced when compared to the positive control group. So when this stress is reduced, the degeneration of the neurons is somewhat under control.
Okay, my is over. I'm done.
Okay, mine is over also. Yes.
Okay. So next participant is poster number 4, Saurabh Bhattacharya. Are you here? Sultana, you can stop your sharing now.
Okay, ma'am.
Thank you so much. Next is Saurabh Bhattacharya. Are you there? Poster number 4, Saurabh Bhattacharya. Are you there? Okay, I guess he is not there in the meeting. So I will move to the next poster. This poster number 6, Leela Haripriya. Are you there?
Yes, ma'am.
Okay, you can start sharing your e-poster.
Okay, ma'am.
Your poster is not visible still.
Hey, Manasa.
Your poster is not visible till now. We hope she is having some technical glitches. Yeah, now it's visible.
Yeah.
Now it's visible. When you are ready, then I will start the time. Okay, okay.
Can I
So
start?
yes. I am starting the time.
Good morning to everyone. I am Leela Haripriya from Acharya B.M. Reddy College of Pharmacy, Bengaluru. I am presenting topic on evaluation of anti-arthritic activity of Physitin and Sansevieria cylindrica leaves extract in Fruins adjuvant induced arthritis in rats. Introduction. Rheumatoid arthritis is a chronic autoimmune disorder characterized by joint inflammation, synovial growth, articular cartilage degradation. Rheumatoid arthritis is caused by the rheumatoid factors, anti-citrullinated peptide antibodies. It mainly involves, it is the body's immune system attached the lining of synovial lining of the capsule, that is the synovial membrane, becomes in rheumatoid arthritis, synovial membrane becomes inflamed and swollen. Eventually, progression of the disease destroys cartilage and bone within the joint. It affects roughly 25 men and 54 women per 1 lakh people in the United States, resulting in 250,000 hospitalizations and 9 million physician visits per year, over 1 million cases per year in India. The most prevalent inflammatory arthritis it is, and which is a major source of disability, resistive disability, systemic problems, early death, and economical cost are linked to it. In this, we perform following evaluation parameters, that is the power volume, arthritis score, radiology of the ankle joint, biochemical estimation like TNF alpha, antioxidant parameters like superoxide dismutase, catalase, glutathione, melandialdehyde, and histopathology of the part tissue. Materials methods, materials Physitin bioflavonoid, ethanolic extract of Sansevieria cylindrica, and complete Fruins adjuvant. Method involved the day of adjuvant injection was noted as the day 1, and the daily oral doses of Physitin bioflavonoid and Sansevieria cylindrica from day 1 to 21 day after injection of the complete Fruins adjuvant. And they evaluate the arthritis score, power volume, and body weight estimated in specific intervals at first day, 7th, 14th, and 21 day. After 21 days, rats were studied and evaluated for the radiology, histopathology, antioxidant parameters, and inflammatory markers. And results, power volume and arthritis score. Power volume in experimental design includes positive control, and ARIA control group. Normal control group is a normal saline. And positive control group is induced with the complete fluent subjuvant. And treatment 1, treatment 2, treatment 3. Treatment 1 received complete fluent subjuvant Fisetin, and Fisetin is a 10 mg per kg. Treatment 2 received 0.1 ml complete fluent subjuvant plus ethanol leaves extract of Sansevieria cylindrica, that is 200 mg per kg per oral. Treatment 3 received 0.1 ml complete fluent subjuvant plus Fisetin 10 mg per kg per oral plus ethanol leaves extract of Sansevieria cylindrica, and standard group received 0.1 ml complete fluent subjuvant plus methotrexate. It
You have to
involves
wrap it up soon. You have to wrap it up soon. So
okay. Results increase the power volume. Paria control group is more power volume compared to the treatment 1, treatment 2, treatment 3, and arthritis score and the radiological score. No
time is
effect
over. Your time is over. Sorry. So I would like to request evaluators to ask the questions.
May I ask? Okay,
Yes,
so
sir.
yeah, so why you have chosen this anti-arthritic activity? Why you have chosen to do these experiments?
Because it is also one of the chronic autoimmune disorder and it affects many peoples. That's why I choose it.
Okay,
It is also one of the
so there are several chronic diseases are there.
yes.
To date, there is no remedies for many diseases. So why you have chosen arthritis only?
I was interested in autoimmune disorder area, so that's why I chosen this one, rheumatoid arthritis.
Okay, what are the present treatment methodologies available for this? Do you know? Can you answer? Okay, so then you have measured catalase dismutase for this activity. So what is the correlation? What are the roles of these enzymes in these diseases?
Sir, rheumatoid arthritis antioxidant parameters, it helpful for regulating clinical outcomes and oxidative stress in rheumatoid arthritis.
Okay, okay, Dr. Dhrubajyoti, you
And
can
rheumatoid
please.
arthritis nowadays are treated by using non-steroid anti-inflammatory drugs, NSAIDs.
Okay,
Yeah.
Miss Leela, I just want to ask you a few questions. Number one is you have chosen a very good drug, good drug, that is Sansevieria cylindrica. So, and you have done the activity in molecular level also. I can see that TNF alpha IL-1 you have chosen, the ISC means immunohistochemistry you have chosen. But why you are presenting this in the conference? Did you send this in the journal?
Sir,
Have you sent
can
this
you repeat?
article to the journal, to any journal? It's a good article actually.
Yes, sir, I am doing, sir. I am doing.
Okay. So same thing you are presenting here.
Yes, sir.
Okay. Anyway, actually the antioxidant activities, I can see the SOD, catalase, these GSH, MDA, all are performed good. Okay, fine. No question from me.
Okay. Thank you,
Okay,
Rila
thank you, sir.
Priya. Okay. You can stop the sharing.
ma'am.
So I would like to, yes, thank you. Thank you so much. So I would like to request Jagobandhu Bag, who is having poster number 7. So Jagobandhu Bag, are you here?
Yes, ma'am, I'm here.
Okay, you just start sharing your e-poster.
Okay, ma'am, I'm sharing.
We're ready, then I will start the time.
Yes, ma'am, I'm finding it.
Yeah, your screen is visible.
Okay, ma'am.
I'm starting the time.
Okay, ma'am. So, a very good morning to all of my distinguished guests, dignitaries, and all my dear friends. So, I am here. My name is Jagbandhu Bag. I am a fourth year student of pharmaceutical technology in Adamas University. And I am here with my topic, that is drug repurposing in the COVID pandemic era, and its challenges and opportunities. So I will be discussing on drug repurposing in the COVID-19 pandemic era challenges. There is many challenges and opportunities that researchers found at that time. So in the present era, where everything has come to stand still, the discovery and or any other invention also about new drug entity is a big challenge that was given the present situation. So after that, the requirements of a specific drug, this COVID-19 on the vaccine, which was already is been in a market there. But the requirements was very least about that specific formulation of the study. So since almost all the labs and research institutes are closed during the strict health protocols, is it remains and a challenges to the researchers and pharmacists to handle the virus. That was really was very tough for handling all the things at that time. So hence repurposing the already always established the drug that is only alternative and left to us. Drug repurposing, this is not just what, this is accompanied with many other purposes and processes. So drug repurposing is the process of application of an existing therapeutic drug to a new disease indication. So this is also called drug repositioning for some time. It in general, there are two basic approaches of drug repurposing. One is computational approach, and another is experimental approach, that is always held in a laboratories or any specific research places. So here spilling more elaborately, the computational approach is based again two type, that one is molecular docking and signature matching. So molecular docking here, like it is a key tool where the structural molecular biology and computer assisted drug design that has been held by making the proper ligand protein docking or mode of ligand that is specific with any protein, and that is done by using taking help of any software. So here the experimental approach is based on two class, like phenotypic is screening and identity relevant targets. So phenotypic screening, like this is the type of screening used biological research and drug discovery to identify substance such as specific molecules, peptides, or RNA polypeptide. So another interesting term that is also come across here in a global repurposing, where researchers are inventing the new way for making or improvement of all that process. So global repurposing is more drug development in terms and time. So it is also in a cost effective. Presently, researchers all over the world are hooking on to the global repurposing.
Time is over, Jagabandhu. Your time is over. Okay. I would like to request.
Okay, Jagabandhu, I would like to ask you my first question, that what are the drugs repurposed in this COVID-19? We were talking about the drug repurposing. So what are the drugs? Can you give any example?
Yes, sir. There are, sir, many drugs like lopinavir, ritonavir, ramdinavir also is there.
What are the how many drugs are resulted from this molecular docking to actual use?
Sir, among them, like as I give the example, they are mainly from remdesivir responded more effectively.
Remdesivir is for a mild type of that COVID-19, right?
Yes, sir.
Yes, that has been used. Okay, okay, Kaushik sir, please.
Yeah, yeah, thank you. So can you tell me where Dr. Jubojyoti asked that you have reported several approach, what is in theory. So can you tell me what should be the, means when you are repurposing a drug, so what is the basis of selection of those drugs?
Sir, here repurposing means, sir, here the process that is existing the therapeutic drugs or new disease, and that is before formulated means, sir, where previously some researchers they collected their data. So based on that era or this purposes, so it is a little bit easy to find or
No, that I know. But my question is, suppose paracetamol, would you like to repurpose that paracetamol for the as antiviral? No, na. So there is some selection basis. So what are those bases? Okay, fine, no problem. Thanks.
okay, sir.
Okay. Thank you, Jagabandhu. You can stop the sharing.
Okay,
Thank
ma'am.
you. Okay. So next is I would like to call Runasri Bora with poster number 8. Are you here? Runasri?
Yes, ma'am. Good morning, ma'am.
Okay, good morning. So you can start sharing your e-poster and start the presentation.
Yes,
So
ma'am.
then I will start the timing. Please share your screen.
Yes, ma'am.
Yeah, it's visible. You can start the presentation. I'm starting the time.
Ma'am, it's visible?
Yeah, start. Please start.
Hello?
Yes, you are audible.
Okay, ma'am. Good morning, everyone. My name is Runasri Bora. I'm from second year, Department of Pharmacology at Acharya and BMRT College of Pharmacy, Bangalore. So, hello, ma'am. Am I audible, ma'am?
Yes, you are audible. Your time already has been started.
So here I'm presenting our research work that is evaluation of cardioprotective activity of Musa acuminata in ischemia reperfusion induced myocardial infarction in rats. So I'm starting with the introduction that heart disease are the significant reason for like mortality in worldwide. Nowadays, it's in large proportion, heart disease are considered like significantly showing in mortality. According to WHO, also depicted that coronary, like it's a disease and best curse. And if we see the statistics in India, the heart disease has turned out to be the most prominent executioner, like in the third most prominent executioner. And comparing to the diabetics and malignant growth, myocardial damage that has created through a time of ischemia reperfusions may have numerous causes. Ischemia typically advances from hypoxia and results in a condition in which the heart cannot keep up with pace of cell oxidation, and that's why it's promoting the metabolic irregular and characteristics. So here our objectives of this research work is to quantify the infract sizes, and we'll see the serum parameters of like aspartate aminotransferases, alanine aminotransferases, creatine kinases, and lactate dehydrogenases. And then when we will check out the antioxidant parameters like by using SOD, catalase, MDA, MPO. So materials and method we have used in our research groups, like we have used Mr. albino rats. We have divided into 4 groups, and then each group will contain 8 animals, and then like doses. Those 4 groups will be giving the doses. First, a normal control group. Second, will be giving saline, that is 0.2 ml, and then the drugs will be given in 2 different doses form. That Musa acuminata drug we will be giving in a 200 mg per kg dose and 400 mg per kg dose, and whole experiment will the animal will get the dose for 21 days. For methods, we have collected the left coronary artery, and then we will be keeping it for occultated for 30 minutes, and then we'll do the reperfusion for 4 hours, and then we'll do the carry out the electroprotective activity. After experimenting for 21 days, we'll collect 8 animals from each group, and we'll sacrifice and collect the blood and then heart tissues, and we'll carry out all the biochemical estimations and histopathological studies. So here I have presented the results. As we can see the results in a graph form. I have represented in a graph form. So we can compare the creatine kinase, lactate dehydrogenases, aspartate aminotransferases, and aniline transferases. These graphs contain the effect of ethanol extract of the Musa acuminata alpil, where it all the they have decreases the serum cardiac parameters. And we have calculated with the help of statistical analysis by using ANOVA test and Taki post hoc test. So even we can
your time is over. Your time is over. So evaluators, please.
Okay,
Okay.
thank you, ma'am. I'm thankful to you people.
Okay, Runasri.
Yes, sir.
My question to you, that Musa acuminata is a type of banana, I think.
Yes,
right?
sir. Yes,
so,
sir.
you have used the peel of the fruit.
Yes, sir.
Okay, peel of the fruit. So how do you confirm that the peel have the active constituent? Anyhow, you have not done the you have not found that lead compound. Anyway, you have done the extraction. So what basis you have selected that peel?
Sir, after doing so much of literature survey, I have found out they have some antioxidant parameters, and then it was showing positive in antioxidant parameters, and then it was decreasing the cardiac markers. So that's why, and after doing literature survey also, so I have selected this
No,
Musa
antioxidant
acuminata peel
parameters are
for.
in vivo or in vitro?
Yes, sir.
In vivo antioxidant parameters or in vitro?
So I have done an in vitro. First of all, I have done the in vitro antioxidant parameters, but even in vivo animal studies also we have done.
Okay. And one more question, that have you seen any lead compound or what type of compound you expected? Have you done the characterization, any characterization?
No, sir. We have just checked the infrared sizes, and then it shows in vitro
After
in vivo
taking the
studies.
extraction, after taking the extract, you
Yes, sir.
just have done the in vitro or in vivo oxidation, then you go for the this cardioprotective activity, but you have not done any type of characterization.
Sir, like antioxidant parameters we have done.
No.
Okay.
No, what Dr. Shorkar is asking, that is, you have taken extract for some kind of activities. Okay.
Yes,
so
sir.
what are the active constituent or active bioactive principle is present? Have you checked that? Hello, can you hear
Yes,
me?
sir. I can hear you. Like,
Yeah.
sir, we have checked the the antioxidant, means what are the
Why
what
I
are the
asked
ingredients?
this question, actually,
Yes.
it should have some primary metabolites. Maximum
Yes,
amount of
sir.
this should have primary metabolites. So
Yes, sir.
we know that primary metabolites are not having any activity, means a therapeutic activity, maybe a few activity, but not that much. So I asked this question: have you done any characterization? Have you found any secondary metabolite? Anyway, Kaushik sir, please.
No, yeah, I'm done. No problem. So next, please.
Okay, thank you, Lunasri. You can stop the sharing. I would like to call the next participant, Manasa, with the poster number 9.
Hello.
Yes. Lunasri, please stop the sharing. Lunasri, please stop the sharing so that we can continue with the other presentations. Yeah. Manasa, now you can start sharing your e-poster.
Yes, ma'am. Ma'am, is it visible?
It has started screen sharing. It's still not visible. Still, it is not visible. Yeah, now it's visible. You can start the presentation. I'm starting the time.
Yes, ma'am. Ma'am, am I audible?
Yes, you are audible.
Okay. Good morning. I'm Manasa from Department of Pharmacology from Acharya and BM Reddy College of Pharmacy. Today I'm here to present my e-poster on topic a review on therapeutic potential of Chicory, Chicorium indibus plant extracts. The products which are available from the nature are normally used as ancient medicine. Here we have selected the plant Chicorium intybus, normally called as chicory plant, Casni or desert chicory, which belongs to the family Asteraceae. In ancient times, chicory was grown as a medicinal plant by Egyptians. It is also used as substitute for coffee and periodically used as feed for livestock. It is also used as a traditional medicine in Unani. The various parts of chicory like roots, leaves, flowers, or also have the medicinal value, and it has a wide range of health alleviating properties such as antibiotic, antibacterial, laxative, diuretics, anti-inflammatory, and also gastroprotective activity. Here I have reported some of the pharmacological activities of the plant extracts. Coming to root, it has proven that it has antioxidant property, and it shows the antioxidant property by reducing the levels of melondialdehyde and glutathione in rats. And it has shown the hypolipidemic activity by affecting the triglyceride mechanism in orotic acid fed rats. And it has also shown the hepatoprotective activity which has been done in pigs. It has affected the hepatic proteins expression, and it has shown the protective action on liver. Coming to the pharmacological activities reported for leaf, it has shown the hypotensive activity by decreasing in the extracellular calcium flow, which leads to the vasodilatory effect. And it has also shown the cytotoxic activity, and the phytoconstituents like flavonoids which are present in the leaf are mainly responsible for showing the cytotoxic activity. And it has also shown the cardioprotective activity in age-related injury and also protect the heart from oxidative damage. And the pharmacological activities reported for seed or anti-hyperglycemic activity, it has delayed the diabetes by enhancing the insulin sensitivity and reducing the insulin resistance and increasing aspartate aminotransferase and lactate dehydrogenase levels. And it has shown the hepatoprotective activity. The chicotiboside, which is a main constituent present in the chicory plant, lowered the increased levels of liver enzymes such as SGPT and SGOT, total protein and albumin in Wistar rats. And the other pharmacological activities are like it has shown the immunoprotective activity and larvicidal activity and anti-HIV activity. And it has also proven that it has main constituents which can have protective action on SARS-CoV-2. And by this, I can conclude that Chicoria mintiburst deserves to be used as more widely in medical prophylaxis, as it has proven that many animal models have shown the hepatoprotective, antioxidant, anti-diabetic, anti-inflammatory, and other pharmacological activities. The potential effects of many of its constituents has not been completely investigated, and further research is needed to be done. Thank you.
Okay, so evaluators, please.
Okay, Ms. Manasha,
Yes, sir.
you have reviewed a plant that is the chicory plant. You have so what are the different active constituents present in the plant? One.
Sir, the
Number
main
two, the related question is, are they different in root, leaf, seed, etc.? Or they are
Yes, sir,
having the
like
same component in different concentration?
hello.
Hello, yes, I'm listening. Did you get my question?
Yes, sir.
Okay.
Sir, it has similar constituents in root, leaf, and fruit, and also seed. But major constituents like volatile oils and alkaloids, triterpenes are majorly present in roots.
Okay.
Shall I ask?
Yes, please.
Okay, please, you finish first.
No problem, Kaushik sir, please.
Okay, so as you told that the several volatile oils are present, so can you name some? Because I don't know about this plant, so I would like to know what are the volatile oil present there. Hello, can you?
Hello.
Yeah, can you listen me? Am I audible to you?
Yes, sir.
So can you answer my question? You told just now that there are in root some volatile oils are present.
Yes, sir.
I would like to the names of the volatile oils. Do you know, or if you don't know, then it is no problem. Fine.
No, sir, I don't have an idea.
So
Okay.
what are the means this activity are actually related to the volatile oil because of volatile oil?
No, sir, like different constituents are present, not only volatile oils like triterpenes, sesquiterpenes. Like based on the different pharma.
Actually, you told the concentration of the active constituent is more in root. So it is
Yes,
very
sir.
rare to present the volatile oil in the root. Number one. Number two, if root is having the maximum concentration, then why people are using this seed and leaf? Anyway, fine. Okay, thank you.
Thank you.
Okay, so thank you. So you
Thank
can
you,
stop
ma'am.
the sharing. Thank you, Manisa. Okay, so I would like to go to the next participant, Radami Var, with poster number 10. Are you there? Yeah, I can see you.
Yes, ma'am.
Okay. Your voice is breaking. Yeah, your poster is visible. Okay,
Yeah.
you can start.
Is it
You can
okay
start
now?
It's okay. We are starting the time.
Yeah, sure. Good morning, everyone. My name is Radami War, and pursuing the MPharm in Acharya and BM Reddy College of Pharmacy, Bengaluru. And the title of the poster I'll be talking about is Synthesis Characterization of Chalcones and its anti-diabetic activity on the esticide-induced diabetic rat. So diabetes mellitus is a metabolic disorder which are characterized by the elevated blood glucose level resulting from the defects in insulin secretion, insulin action, or even both. And these abnormalities, they can lead to the alteration of the metabolisms of the lipids, carbohydrates, and amino acids. So this chronic hyperglycemia, that results in the impaired function or failure of various organs like the eyes, kidney, nerves, heart, and blood vessels. So according to the WHO report, approximately 150 million people are suffering from this diabetes mellitus throughout the world, and this number may even double by the year 2025. So here we use a chalcone, and this chalcone is an open chain intermediate containing benzylidine acetophenone, where the two aromatic nuclei are joined by a carbon alpha, beta unsaturated carbonyl bridge. These chalcone are reported to be precursors of the flavonoids and isoflavonoids. So the parameters which are evaluated in this studies, that is blood glucose level, total cholesterol, triglyceride level, HDL, LDL, and even the histopathology of pancreas. So the materials used are streptozotocin and the synthesized chalcone derivatives. So the male Vista albino rats weighing 150 to 180 grams were used in the studies, and the diabetes were induced in overnight fasted male albino Vista rats by streptozotocin 45 mg per kg IP. So the synthesized chalcone's derivative, that is 200 mg per kg, was given once a day to a diabetic rats for 21 days, and the blood glucose levels were estimated, including the total cholesterol, triglyceride, as mentioned above, were all estimated. So the rats were divided into 4 groups, and each group consists of 6 animals. That is, group 1 is a native control, group 2 is positive control, where SZ is given here. Group 3, that is the treatment 1, that is 3-hydroxy-2,3,4-nitro acetyl 5-methyl cyclohexa 2,5-dienone, and a group 4, that is treatment number 2, 3-hydroxy-2,3,4-methoxy-phenyl acetyl 5-methyl cyclohexa 2,5-diene were used. Coming to the results, as we have seen here, that the blood glucose level, it significantly decreased with the compound 2 as compared to that of the compound 1. The cholesterol level also decreased significantly with the compound 2 as compared to that of the compound 1. Same with the triglyceride level, and HDL level significantly increased with the compound 2 as compared to that of the compound 1, and the LDL level show that a significant decrease with the compound 2 as compared to that compound 1. So, the histopathology of the pancreas shows that the normal animals shows the intact islets of Langerhans and that of beta cells, and a positive control animals show fully damage of the islets of Langerhans, no visible of the beta cells. And treatment 1 shows a destruction of islets of Langerhans with very few numbers of the beta cells, and treatment 2 show a moderate destructions of the islets of Langerhans with a few numbers of the beta cells. So from the above study, we concluded that the administration of the synthetic chalcone compound 2, that is 3-hydroxy-2,3,4-methoxyphenyl acetyl 5-methyl cyclohexa 2,5-diene show a better glycemic
Time
control
is
and
over.
improve the lipid profile compared
your
to that of
time
the
is over.
compound 1. Thank you. Yes, ma'am, I'm done.
Okay, Radami. So my question is, you have used STJ to induce the diabetes, and 45 mg
Yes,
I
sir.
can see. So what type of diabetes is induced by this? Number one question, and related question is, what is the standard drug you have used? Have you used any standard drug?
Sir, we don't use any standard drug here. We use the chalcone derivative, 2 derivative we use. After we give the control, we directly go for the positive control, that is we induce the diabetes with streptozotocin, and then we have these 2 derivatives.
Okay. So type 1 or type 2, it is STJ 45 mg per kg body weight.
So for type 2.
Type 2. Usually STJ cannot produce type 2 because the cells of the Langerhans, they are completely destroyed. So if I am not wrong, Kaushik sir can give you more emphasis on that.
No, where it is coming from. Okay. So yes, Dr. Sarkar, it is exactly right, because streptozotocin with nicotinamide, they are actually inducing the type 2. So streptozotocin alone is not capable to induce the type 2. So this is the very confusion with the students and among the pharmacologists also. So there was a great debate on that. So I think this is wrong. This is not the correct method of induction of the type 2 diabetes. This is very rightly pointed out by Dr. Sarkar. Then my question also was this. Additionally, I would like to ask your synthesized compound, how it is characterized and what is the solubility?
So it is characterized by using the IR,
Okay.
NMR.
Okay. NMR means only 13C?
Hello.
Yeah. Hello. Can you hear me? Can you hear me? I can hear you. You are audible. Yes.
Yeah. Yes, sir. Yes, sir. Yes, I can hear.
Yeah. So what about its solubility? Hello. Have you checked the solubility because you have injected it now? So, hello.
Hello, Radami, are you there? Hello, Radami.
No, I think not. She can't hear us.
Yeah, Radami, can you hear me?
We can move. We can move forward, ma'am.
We can move. Yes. Acha, Kaushik sir, I'm
Yeah,
just
yeah.
coming. Please evaluate for 2 or 3 minutes. I'm just coming after a photo session. I have a photo session over here. Huh?
Okay, okay. Sure, sure. Thank you.
Radami, stop the sharing. You can stop the sharing. Radami, please stop the sharing. I would like to call
Yes, ma'am.
Athira.
Sure.
Radami, please stop the sharing. Athira with poster number 11.
Yes, ma'am.
Yeah, share your screen.
One minute, ma'am.
Yeah. Athira, share your screen, please. Athira, your screen is not visible.
1 minute, ma'am. I'm trying.
Okay. If you are having technical glitches, you can let us know. We can schedule your at the last.
Okay, ma'am.
Should I wait or should I move to the next one?
Move forward, ma'am. I will present later.
Okay, okay, fine. So next, Ankit Rai. Are you there?
Yes, ma'am. Yes, ma'am. Can you hear me?
Okay. Yes, yes. You can start sharing your e-poster.
Okay. Ma'am, is it visible?
Yes, it is visible. I am starting your time.
1 second. ma'am. I'll put on /3. ma'am.
Yeah.
Yes, ma'am. Good morning, evaluators, and myself, Ankit Rai from Department of Pharmacology, Acharya and BM Reddy College of Pharmacy, Bangalore. My poster title is Effect of Thuja occidentalis on oxidative stress and cardiac markers in rats with isoproterenol-induced myocardial infarction. Coming to introduction, cardiovascular diseases are including atherosclerosis and cardiac tissue injury after myocardial infarction are the more common cause of death and disability worldwide. Here we have used isoproterenol for inducing myocardial infarction. Isoproterenol is a catecholamine used for bradycardia, and it is also used as a myocardial infarction inducer. It causes severe stress in myocardial, resulting in infarct-like necrosis of heart muscle and generate free radicals and stimulate lipid peroxidation. Objective of our study is the purpose of this study was to evaluate the drug Tuda occidentalis leaves could protect rats from isoproterenol-induced myocardial infarction. Material and methods. We have used adult male albino visitor rats. Those are divided into 4 groups, each containing 6 animals. Group 1 serves as a control group. We have given with the distilled water every day. This study was conducted for 30 days. The group 2 was isoproterenol group that serves as a disease control. We have given isoproterenol 85 mg per kg subcutaneously at an interval of 24 hours on 29th and 30th day. The group 3, the hydroalcoholic extract of our drug Tuda occidentalis 200 mg per kg, and followed by group 4, higher dose 400 mg per kg of the Tuda occidentalis. Those are administered orally along with the isoproterenol subcutaneously on the 29th and 30th day. The drug Tuda occidentalis is also known as white cedar family Cupressaceae. We have used hydroalcoholic extract for this study, and we evaluated 3 results: histopathology and cardiac. We have evaluated the serum cardiac matter markers and antioxidant parameters. So the results, the effect of hydroalcoholic extract on our drug leaves on serum cardiac markers. Hydroalcoholic extract of Tuda occidentalis leaves, that is 200 mg and 400 mg per kg, showed significant decrease in creatinine kinase, aspartate aminotransferase, alanine aminotransferase, and troponin levels compared to ISO group, that is disease control, and that showed a positive result to protect myocardial infarction. Then coming to tissue and antioxidant parameters such as SOD, GSH levels, and antioxidants such as MPO, MDA were significantly decreased in ISO group compared to control group. The much effect was shown in the higher dose, that is 400 mg per kg. In histopathology, we can see here control group, we have no necrosis and normal structure of the microfibrillary tangles, and in ISO group, that is disease control group, there is much necrosis that was prevented by our drug hydroalcoholic extract of Tuda occidentalis 200 mg and 400 mg.
Your time is over. The time is over.
Thank you.
So, shall I proceed, ma'am?
Yes, yes, sure.
So, yeah, it's a good activity. It's a good
yes,
experiment you have done. So, my first question is, when you have done the histopathological studies,
Yes.
so what I can see, have you compared with the standard isoproterenol with your extract?
Yes, sir. As isoproterenol, we can see much necrosis. When we compare, there is somewhat decrease in the necrosis, sir.
No, but
We can see decrease in the necrosis in my higher dose, 400 mg per kg.
okay, here which one is isoproterenol?
So the second picture.
Second one. See, if you look at that, because I'm looking in a small picture, but
Yes.
my doubt is what you told in isoproterenol. You see, there is some more reddish than your extract. So what these actually signify?
So,
Can you
I'm not
observe?
aware.
Because I think you have seen more closely. I can't see more closely, but my observation is that. So it is very interesting. And second is
Yes.
Have you isolated the heart?
Yes, sir.
Before histopathology, have you isolated that?
Before histopathology, for histopathology, we isolated, sir.
Yeah. So how you in administered the drug?
Per oral, sir.
Per oral. Okay.
Yes, sir.
Okay. And one more question is, it is hydroalcoholic extract yours is it?
Yes. Yes, sir. Yes, sir.
So in which solvent they are soluble?
Sir, 300 mg of solvent. It is
Which solvent? Which solvent?
Sir, water only, sir.
Water only.
Sir, alcohol, sir. Water and alcohol, sir.
No. Before administration of the drug into the animals,
Yes,
the drug is soluble in which solvent?
Sir, while administering, we triturated with some acacia, sir.
Yeah, that I want.
Yes, sir.
Okay, thank you.
Yes, sir. Thank you, sir. Any other questions, sir?
Ankit,
Yes, sir.
I have a question that you have used hydroalcoholic extract. So
Yes.
which alcohol you have used?
Sir, ethanol, sir.
Ethanol. Okay. And used 200 mg, 400 mg PO. Okay. And you have used some standard drug. Did you use any standard drug?
No, sir.
Okay. Okay, fine. Thank you.
Thank you, sir.
Okay. Thank you, Ankit. You can stop the sharing. I would like to call next Manasa in with poster number 13. Manasa, are you there?
Yes, ma'am.
Okay, Ankit, please stop. Yes.
Yes.
Manasa, you start sharing.
Okay.
Yeah, it's visible. I'm
Good
starting
morning,
one time.
everyone. Okay. My
Yeah.
voice is audible, ma'am.
Yes.
Good morning, everyone who are all present here. I'm Manasan, Department of Pharmacology from Acharya and BM Reddy of College. My project title is Conferral aldehyde evaluated in haloperidol induced Parkinsonism in Wister albino rats. The Parkinsonism is a long-term degenerative disorder of the central nervous system that mainly affects the motor system. The symptoms may be tremor. Then coming to our objectives here, we have used haloperidol as an inducing agent in Parkinsonism in rats. And we have evaluated motor coordination. It includes catalepsy, rotor rod, and actophotometer we have evaluated. And biochemical parameters like TNF-alpha and antioxidant parameters like SOD, GSH. Coming to materials and methods, we have 4 groups. First group is negative control. It includes normal saline. Second group is positive control, that is haloperidol, 2 mg per kg through IP route. And the third group is treatment group. We have given here conferaldehyde because this conferaldehyde has an inflammatory properties and it is an flavonoid, phenolic flavonoid. Then group 4, we have standard group. We have to levodopa and carbidopa. And coming to results, we have there is an decrease in GSH and dopamine and acetylcholine level is increased. Coming to histopathology, there is a decrease in positive control group. Yeah, thank you.
Okay, so evaluators, please.
Yes, sir, please.
Okay. So I think 2 similar activities we have seen in today's presentation. Both are haloperidol induced Parkinson. So the only single question from me is, have you checked whether your extract, the pharmacokinetic property, whether they are crossing the Means when you are targeting in Parkinson's, so that should cross some certain level that should penetrate in the CNS. So have you checked that? How can you confirm?
So we have did like other parameters we have did.
No, that is very biochemical parameters which is correlated with the pharmacology. But here the basic question comes, because you are targeting CNS, so it should cross some barrier. What are those barriers and how can you confirm? Have you some knowledge?
Hello.
Because you are pharmacology MPharm, so you have to know this.
Yes, there is a blood-brain barrier we have.
So how can we test that? Experimentally, how can we confirm that?
I have no idea, sir.
Yeah, because scientifically, when we are designing some experiment, so there should have to be some scientific basis. So okay, Dr. Sharkar, please.
Okay. Same activity we have seen that haloperidol induced Parkinsonian in Wister albino rats. Okay, fine. So what is the source of this coniferaldehyde?
Sir, it is
Have you
obtained.
synthesized or you have extracted? For some...
Sir, we have extracted.
Okay, from what?
Using ethanolic extract, sir.
Means you have used the lead compound or you have used the extract?
Extract, sir.
Okay, then you should mention that in the topic that extract, this coniferally enriched extract, you can say after characterization. Anyway, what are the characterization you have used for this to detect this coniferaldehyde? Am I clear? My question is clear.
Yes, sir.
Yes. What are the different characterization method you use to detect the coniferaldehyde from the crude drug?
We have used solvent extraction process.
Solvent extraction process is not a characterization. Anyway, thank you.
Okay. Thank you, Manasa. So next, Mahalakshmi M. Manasa, you can stop the sharing. Yes. Mahalakshmi M, are you there? Mahalakshmi.
Yes,
Okay.
ma'am.
You can start sharing the e-poster.
Yes, ma'am.
Yeah, it's visible. I'm starting the time.
Is it visible, ma'am?
Yes, it is visible. You are audible as well.
Okay. So a very good morning to everyone. My name is Mahalakshmi. I'm pursuing my MPharm from Acharya and BM Reddy College of Pharmacy, Bengaluru. So today I'll be giving my e-poster presentation based on the topic review on herbal drugs and herbal formulation approaches to mitigating pancreatitis. So firstly, pancreas is a blended organ that carries both exocrine and endocrine work. Exocrine portion of the pancreas is 99% of the overall structure and participates in digestive activities such as pancreatic juice secretion through pancreas. So endocrine part of the pancreas represent around 1% of the total structure and controls several physiological functions through hormones such as insulin release. So coming to our main point, pancreatitis. Pancreatitis is nothing but the inflammation of the pancreas. So the inflammation of the pancreas will be known as the pancreatitis. Pancreatitis is broadly classified into acute and chronic. Acute pancreatitis is for short term, that is where inflammation of the pancreas develops quickly. And coming to chronic, where inflammation of the pancreas that does not heal or improve, and it gets worsened with the time and leads to permanent damage of the pancreas. So acute and chronic pancreatitis can be further classified depending upon their symptoms and clinical manifestations they are having. So pancreatitis can be treated in mild cases, but severe cases can have life-threatening consequences, as they are ranging from 3% to 10% throughout the human history. So here we have surveyed through literature of reviews. So in that we have chosen Korean red ginseng, galangal, amodin, turmeric, rain, rutin, crambin, and bicalin. These are the herbal remedies treated in pancreatitis. So coming to Korean red ginseng, which belongs to Araliaceae family, which is found in Korea, or which will be grown in China as well. So the main portion is that it blocks the nuclear kappa factor, which is a protein complex that controls transcription of DNA, cytokine, and cell survival. So coming to galangal, the tissue level of pro-inflammatory cytokines, chemokines produced by macrophages such as TNF alpha and interleukin 18 correlate with the severity of AP. There will be reduction in pro-inflammatory cytokines treated with galangal. So coming to amodin also there will be a blockage of nuclear factor kappa B. So curcumin inhibits the nuclear factor kappa B, which controls the inflammation, cell division, apoptosis, and cell resistance. Rain and rutin, they also reduce, several animal studies have showed that they reduce the inflammatory cytokines, which causes pancreatitis. So coming to our Chinese herbal formulations, we have Chengui decoction, Qingui decoction, Hyoyo Qingui decoction plus recombinant staphylokinase, Yu hidden herbal ointment, and the Chengui decoction. So coming to our first herbal drug formulation, that is, the formulation consists of the active ingredients such as amodin, kynsin, rutin. So the main work will be which is pancreatic necrosis, sepsis, damage in rats, and experimental AP caused by sodium taulochlorid and L-arginine will be induced. So in this herbal formulation will be we have recorded that they will be reduced inflammatory cytokines.
Time is over. Your time is over. Sorry. So evaluators, please.
Malashmi, first my question is, which type of formulation you are planning? Actually, you have done the review before your work, I think, before starting your work, right?
Yes, sir, it's just a review.
You are just a review. You are planning to do some formulation and work on this, right? So
yes, sir,
what type? Yes. So what are the different formulations you are expecting from these ingredients?
So, like throughout the literature review I have went through, there is some Chinese formulations going on. So I am planning like for different formulation, like going with different ingredients.
No, sir, that I understood. But is it what type of formulation? It is polyherbal formulation, or you are planning tablet, capsule, syrup? What is suspension? What is the formulation you are expecting?
No, sir. Like I'm starting to go for herbs only, as I'm having a lot of information regarding that.
Did not get my question. You have selected some herbs, no problem. You have selected different active constituents which are available in the Chinese formulation, as well as this rain, rutin, galantin, emotin. They are also available here, but from other sources. I understood that. But my question is, what type of formulation you are expecting or you are planning for?
Like we are planning, like mainly I have went through some Chinese herbs. So we are planning for India herbs with anti-inflammatory property.
Okay, Kaushik sir, please.
Yeah, I only have one question. So why you have done this review? Why you want to do this review?
As I told, that death rate of pancreatitis has been consistently ranging from 3% to 10% throughout the human history. So before it become a serious condition, its treatment should be available. That's why I'm just focusing on this.
Okay, thank you. Thank you.
Okay. Thank you, Mahalakshmi. You can,
Thank you.
yeah, welcome. You can stop the sharing. Next, Mohan Naga Kumar with poster number 19. Mohan Naga Kumar.
Ma'am.
Are you there?
Yes, madam. Yes, ma'am.
Yes.
Audible, madam?
Mahalakshmi, yeah, you are audible.
Okay.
Mahalakshmi, you stop the sharing, please. Mahalakshmi, please stop the sharing.
Yes, ma'am.
Mahalakshmi, please stop the sharing.
I'm trying. It's not.
It's okay. It's okay.
Mahalakshmi, do one thing. You just leave
Ma'am,
the
it's
meeting
not-
again. You leave the meeting.
Okay.
Then you again join if you want.
Okay.
Yeah, okay. Thank you. Mohan Naga Kumar, please share your screen. Mohan, yes.
Okay, madam.
It has start. Yeah. It has started the
Okay.
sharing the screen. Yeah, now
Okay.
it's visible and you're
Okay.
audible. You can
Okay,
start.
madam. Okay. Actually, good morning to all. Myself, Dr. B.M.N. Kumar, Associate Professor, Faculty of Ayurveda, IMS, Banaras University, Varanasi. Actually, this is my topic, Ayurvedic herbs for viral diseases. Actually, nowadays, this topic is very essential due to COVID-19 pandemic is going on. Entire world actually scared about virus due to COVID-19 pandemic. Every individual concentrating about learn the virus, know about virus and its preventive methods. Actually, viruses are the smallest microorganisms everybody knows. So many viruses are there already create so much any condition in the entire world, that is pox virus, herpes virus, zoster virus, endovirus, hepatitis virus, so many viruses are there. Regarding Ayurveda, actually in Vedas, this is our science, in Vedas as well as Ayurvedic classic like Charaka Samhita, Sushrita Samhita and Ashtanga Hridaya, they know the only one term regarding virus, that is called krimi. Under this heading, they put all the things like bacteria, virus, fungus, and parasites, and they give some medicines that is under the heading of Krimigna. Krimigna Dravya means antiviral, antibacterial drugs. Going to the literature here, they mention some drugs and their useful parts. Available in Ayurvedic literature with visual parts. These are Acranthus aspera and Acarus calamus, Ilium sativum, Aristolochia, Agad recta, and these drugs normally available in Ayurvedic literature, and these using for Krimigna Dravya. And they also mentioned the here in Ayurvedic literature their useful parts. Suppose Acarus Acranthus aspera, these are the leaves, and after that, nowadays, the modern research scholars done some experimental methods and clinical trials. They particularly this plant is acting on this disease. This is actually they find out in different animal studies. And other than this, going to the discussion why Ayurveda is nowadays important. Actually, modern medicine is very effective. Everybody knows. At the same time, that gives some side effects that minimize harm. And nowadays, so it comes so many variants. And main aim of Ayurveda is here the preventive methods, prevention of the viral diseases. Prevention is better than cure. That is the main theory of Ayurveda. That's why Ayurveda is mainly concentrated on immunity, immunoboosters, immunomodular drugs, immunomodular formulations. Then Here, so many phytochemicals find out in these drugs like flavonoids, like terpenoids, organosulfur compounds, and ligand, and seeing their action, they're seeing their pharmaceutical action here. Actually, these phytochemicals action is here, works as antioxidants and inhibition of viral entry in the body and scavenging activities, inhibiting DNA, RNA synthesis, and inhibiting the viral reproduction. That mainly its concentration is here prevention. Actually, my aim of this paper is actually I want to bring our science in front of the world, in front of through this platform. Actually, everybody is talking about modern medicine, but nowadays it has the same importance to the Ayurvedic medicine after COVID-19. This is actually my aim. I will put some drugs here. So thank you very much. This is my presentation only. You poster.
Sir, thank you for presenting the paper. I'm a pharmacognosy student, and from your literature, I have enriched myself. So thank you for that. This is not my question to you. Just I have a query that what formulations you are making from these herbals, or these herbs are very good in nature, but what are the formulations? I want to know, because so much
Actually,
research aspects are there. If we have the Ayurvedic formulation with these herbs.
Yes, sir. We are normally making some powders. That means churna and the tablet form, and like Samanapras, like some liquid, some chewable things also. These are the main formulations in Ayurveda.
So is that possible to do research on these formulations?
Yes, sir. Actually, research is going on. Actually, these formulations.
Okay.
They're getting some extracts. They're doing research about the extracts, and they're getting some phytochemicals. After there may combinations they're making, sir.
Okay, sir. Okay, sir. Thank you, sir.
Okay. Thank you, Dr. Kumar. Thank you for your presentation.
Thank you very much.
Stop the sharing. I would like to call poster number 22, Akshata. Are you there?
Yes, ma'am.
Okay, you can start sharing your screen. Yeah, it's visible. I'm starting the time.
Yeah, ma'am, fine. Very good morning to everyone. This is Akshata, pursuing a master degree in pharmacology from Acharya and BM Reddy College of Pharmacy, Bengaluru. And I'm here to present a poster entitled Cytotoxicity of Polysaccharide Conjugated 5-fluorouracil on two different cell lines, 3T3L1 and C2C12 cell lines. As we all know, cancer is a leading cause of death worldwide, which is characterized by uncontrolled proliferation of cells, which tend to invade surrounding tissues and metastasize. According to the WHO data, globally, nearly 1 in 6 deaths is due to cancer. Cure is, however, seen in approximately 35% of the cases. Speaking about the treatment, commonly used treatment for cancer is cytotoxic chemotherapy. Potential efficacy of available anti-cancerous agents is limited by lack of drug selectivity. That is, tumor cells retain most of the characteristics of the normal cells, non-specific damage to the healthy tissues, and multiple mechanisms of drug resistance. This gives rise to the need for the new and improved cancer therapy. Therefore, various drug delivery systems have been explored in the last 3 decades. Our study considered the conjugation of standard drug 5-fluorouracil with the polysaccharide chitosan. Cytotoxicity to the cancer cell is one of the main characteristics that should be possessed by an anti-cancer agent. So we have used MTT assay of drug conjugate on 2 different cell lines to know the percentage inhibition of cell proliferation. The main principle behind the MTT assay is based on the ability of the viable cells to reduce tetrazolium dye, that is MTT, to its insoluble formazan product of the purple color. The procedure of the MTT assay is as follows. The cells were seeded in the 96 well plates and incubated at 37 degrees Celsius in a humidification incubator with a 5% of carbon dioxide. After incubation, the cells were incubated with a test drug in different concentrations. We have used concentrations like 1000, 500, 250 micrograms per ml concentration and so on for 24 hours. Then added with the MTT dye, followed by incubation. Plates were then analyzed colorimetrically for visible change in color of the dye at 540 to 595 nanometer. According to the study results, we have obtained the percentage inhibition of cell proliferation is 22.01% on 3T3L1 cell lines and 31.21% inhibition on C2C12 cell lines at 1000 microgram per ml concentration. And it was demonstrated that 5-fluorouracil conjugate has shown prominent cytotoxicity on various cancer cell lines as proven by the in vitro cytotoxicity assay. Hence, we conclude that cell-based assays help in the selection of chemotherapeutic drugs with the greatest likelihood for the clinical effectiveness and in the exclusion of ineffective therapy. That's my time, ma'am. Thank you for your valuable time.
Okay, evaluators, please.
Yeah. So, yeah, it's a good activity. So, can you tell me about your cell line choices of cell line?
So we have taken three cell lines, which are derived from the mouse. The cell type is fibroblast type of cell. Okay. So one more cell line we have selected is C2C12, which is myoblast cells, which are originated from the thigh muscle of female mouse.
Okay.
Which are muscle cells.
But when you are using 5-fluorouracil,
yes, okay, sir.
Is it relevant to choose that fibroblast, that type of cell?
So, according to our literature survey, we have seen some of the articles where they have selected these two cell lines. So we have gone with that cell lines.
Okay, but I have doubt. Okay, no problem. So
yes, sir. I'll refer and see.
Yeah, sure. And then is about your pharmaceutics. That is why you have chosen this chitosan.
So chitosan is a linear polysaccharide which composed of beta-linked glucosamines and beta D-glucosamines. So these
no means when you have selected this polymer. Okay.
Yes, sir.
So what do you think?
So polysaccharides conjugation will offer several advantages. There is advantage of ease of formulation and their size maybe or the covalent linkage of to the anti-cancerous drugs. So we have selected that, sir.
Okay, and what added advantage you have received from this study? Because when you are conjugating this chitosan with your drug,
yes,
some advantage you have noticed might be. Okay, so what are those?
So main thing is this cytotoxicity we have observed, sir. And
that is your purpose. That is your purpose. Now the question is drug delivery. So you have chosen chitosan to facilitate the delivery. Okay. So what kind of facilities or what kind of advantage you have noticed?
We have seen improvement in pharmacokinetics properties at the cellular level.
Yeah, that I want to ask. So what are those? What are those?
So in vivo studies we have not done yet, sir.
Okay. One more is when we are formulating this chitosan with your drug. So
yes,
have you tested some whether they formulated well? Some analytical tests have you done?
Yes, sir. We have done the characterization through NMR and FTIR.
Yeah, that you should mention in here. Okay.
Okay, sir. Okay, sir.
Okay, thank you.
Thank you, sir.
Okay, thank you. No question from me.
Thank you, sir.
Thank you, Akshata. You can stop the sharing. Thank you. Next, I would like to call Nikita. Are you there? Yes. Share your screen to show the poster. With poster number 24.
Okay, Lydia.
Yeah, it has started to share the screen. This
Yes, ma'am. Is it visible?
it is visible and you are audible. I am starting the time.
Okay, ma'am. First of all, very good morning to everyone. I'm Sai Nikita. I'm from the Acharya BMRD College of Pharmacy, Department of Pharmacology. Today my topic is in vitro cytotoxicity of polysaccharide conjugated 5-fluorouracil on MCF7 and L6-7 lines. It includes, coming to the introduction, cancer is a leading cause of death worldwide and a diverse group of disease characterized by uncontrolled proliferation of anaplastic cells which tend to invade surrounding tissues and metastatize to other tissues and organs. Around one-third of deaths are from cancer or due to the 5 leading behavior and dietary risks of high body mass index, low fruit and vegetable intake, lack of physical activity, tobacco use and alcohol use. Tobacco use is the most important risk factor for cancer and responsible for approximately 22% of cancer death. 5-fluorouracil, which is a cancer drug, uh, is an anti-metabolite of the pyridine analog type with a broad spectrum of activity against solid tumors, and it is the gastrointestinal tract, include ovary, liver, brain, breast, etc., alone or in combination with chemotherapy regimens, and it interferes with the nucleoside metabolism and incorporated into RNA and DNA, leading to cytotoxicity and cell death. Coming to the methods and material, it includes DMEM and FBS, penicillin, streptomycin, and it includes the procedure for the MTS assay, which includes cell culturing and the cryptonization. In this procedure, we need to seed the cells in the 96-well microtiter plate in a final volume of 150 ml with the medium and incubate at 37 degrees Celsius in 5% CO2 incubator. The next day, treat the cells with the different concentrations of the drug by the double dilution. After a period of incubation, add MTS reagent to the all weights and incubate. Then final, we will get the results through the measure the absorbance under the 490 nanometer to 650 nanometers. Coming to the results and conclusions of the MCF7 lines. The dose of the 5-fluorouracil conjugate under the 1000 mg per ml, it has got the percentage inhibition of 15%, and the highest
1 minute is there.
under the 15 mg per ml, it is the 21.68, and coming to the L6-7 lines, the highest percentage inhibition we have got under the 1000 mg per ml, and the lowest inhibition we have got at the 1 mg 0.95 ml. And by performing this, we have concluded that the cytotoxicity response of different cell lines, which evaluated using the high throughput cell-based assay in the MTS assay, and cell-based assays may help in the selection of chemotherapeutic drugs with the greatest livelihood for clinical effectiveness and in the exclusion of ineffective therapy. This study demonstrated that the 5-FU conjugate has shown the prominent cytotoxicity on
Time
various
is over. Your time is over.
Same kind of activity because earlier one also. So you tell me why we generally target the cytotoxic activities to treat the cancer patient or the cancer?
Yes, sir. Can you repeat the question, sir?
Yeah. Why we generally prefer cytotoxic components or cytotoxicity as a principle in the treatment of cancer?
Because it action of the chemotherapeutic actions on the living cells, it of the anti-neoplastic agents.
I think the question is not clear to you. Okay, then can you explain this? You have done the MTT assay, I think.
Yes, sir.
Yeah, yes. Then what you observed in microscopy, and what kind of microscopy you have done?
We have done through the NMR and the UV.
No. NMR is not the microscopy. I'm asking about microscopy, microscopic studies. Have you done?
I'm not aware of that properly.
Okay, thank you. No problem. Please, Dr. Shankar.
No, actually, Kaushik sir asked you, sir, what microscope or what microscopic features you have used to detect the cell lines. Did you get it? Means you have given some pictures. How do you get the pictures? Diagrams.
Yes, sir. That
The result section, yes, in the result section.
we have performed during the experimental setup, sir, that we have gone through that through the ATCC design. And
Okay, thank you.
Okay.
okay, thank you.
Thank you, Anikita. So you can stop the sharing. I would like to welcome Pinky. Pinky, are you there? Pinky Sharma with poster number 25.
Yes, ma'am. Yeah, ma'am. Very
You
good
can
morning.
start the sharing.
Good morning, everyone. Ma'am, I am struggling with the internet connectivity, and I've just shared the PPT with that SOPT email ID from where we are getting the communication. Have you got any PowerPoint presentation from the team? Because I'm struggling with this internet connectivity, and I've joined from the phone.
Yeah. So then, can you please wait for a few? So other presentations we will finish, and then we can go to yours. Okay.
Oh yes,
So let me
probably
check.
next one. Yeah, next one maybe can start, and I'm just talking to that internet people.
Sure. As soon as I receive that, I will start your presentation.
Yes, and most probably by the time my issue is also resolved, maybe this candidate can present, and after that I can do that. Yeah.
Okay, sure. So then
Sure,
we
ma'am.
have.
Thank you
Yeah.
for understanding.
Thank you, sir. Welcome. So next we have Tanma Chatterjee with poster number 26. Chatterjee, you can start sharing your screen.
Oh, okay, ma'am, 1 minute.
Yeah, it's visible. I am starting the time. We can't hear you. We can't hear you.
Ma'am, am I audible now?
You are audible now. Now you can start.
Good afternoon to my respected dignitaries, respected faculty members, and my fellow classmates. Today, I am here to present my review topic. Gut bacteria can prevent tumors and cancer therapy and can aid in cancer therapy. So, coming to the introduction and abstract part, a researcher.
Your voice is breaking.
It is not coming.
Your voice is breaking.
My voice is breaking.
Yeah.
Now am I audible?
Now it's okay.
So, researchers of Johns Hopkins University found that gut bacteria that are present in the mice can penetrate cells brush border lining and goes to tumor cell and create interaction and destroy the tumor cell. So this separates that kind of
You are not audible. You are not audible.
Actually, ma'am, I am in university.
Yeah, your voice is breaking. We can't hear you.
Ma'am, now am I audible?
No, it's still not audible.
Okay, Tonmai, leave it, leave it. I want to ask you one question: that which class, class you are studying? Means which year? First year, second year, or third year?
No, we can put this one later.
Yeah, I guess.
Okay. I think yes. Let him come to a good.
I can reschedule it. Okay. Okay, so then I will move to Showmindu Mondol. Are you there?
Ma'am, this is Pinky. I am ready with the screen now. If you allow.
Okay, Pinky. Yes. Showmindu Mondol, please wait. Please wait
Sure.
there. So I can wrap up with Pinky. Pinky, you just.
Sure, ma'am. I am just sharing my screen. Please let me know when everybody can see that. Ma'am, is my screen visible?
Visible, but it is supposed to be poster, I guess.
Yeah, ma'am, but I confirmed with Dr. Manish Gautam. So he said whatever way I want to present, it's fine. Dr. Manish Gautam.
Okay, fine. Then you can present.
Yes, ma'am. Thank you so much. Good morning again, everyone. Anvesha ma'am and everyone in the team here. Myself, Pinky Sharma, and I'm from GD Goenka University. The topic I'm going to talk about here is novel cancer therapies, a difficult journey to market. So basically, it will be my PhD research topic, wherein I am going to talk about or study about the cancer therapies and their journey, which is really, really difficult when it reaches to the market, and a lot of development issues happen. So I'll be going to talk about the background of my research here, the gaps I have encountered, the objective of my research, the methodology I'm going to follow, and the expected outcome of the research. So as we all know that cancer is a very, very deadly and scary disease. It is the second most death-causing disease across the world. These are the type of the cancer that are prevalent throughout the world with their percentage as per Globocon 2020. As we can see, the breast cancer in female is found to be very, very common across the globe. So what is my agenda of this research? As we all know that most of the researchers, the scientists, they are struggling to find such a therapy which can deal with the chemotherapy and the conventional side effects that the patients follow, that have to face. So those researchers are trying to get novel therapies which can give a better aspect of the treatment to the patients. But are there sufficient guidelines available for them? Are there any support from the regulatory structure to those therapies? The answer is no. So these novel therapies are struggling to get into the market, and there is no harmonization about these guidelines. So in one country the guidelines are different, and another country the guidelines are different. So this is going to happen as a gap for my research area. So as the issues and challenges I was talking about, any therapy like stem cell therapy, hormone therapy, the new novel cancer therapies that are existing in the research, they are facing the technical issues. The outdated guideline is one of the concerns that they are facing, and as I just talked about, the lack of harmonization of these guidelines. So what I'm going to do, what would be the objective of my study will be, like I will be talking to the stakeholders of these therapies, like the manufacturers, researchers, the people who are involved into clinical trial, the regulatory submission people. So I will be speaking to them. I'll be talking to them through the questionnaires, through the emails, and I'll try to gather the data wherein I can get a brief idea that the challenges, what kind of therapies they follow, and and I'll reach to a point wherein I can suggest some regulatory suggestions to the authorities to reach to a regulatory frame structure. So what kind of methodology I am going to follow? I'm at the stage of literature review, and I am gathering the guidelines, the kind of challenges these therapies are facing. So what I'll be doing is I'll be comparing the regulations of US, EU, Australia, and
1 minute
India.
is there.
Yeah, sure. So, and the challenges I've just talked about, these challenges will be taken through the questionnaires and the web-based survey. So that data will be analyzed, and I'll be drafting the recommendations for the new regulations to the regulatory authorities. So what is the expected outcome? Through this research, I'll be able to gauge the challenges that the company's researchers are facing. And through that, I'll be providing the recommendations to the regulatory authorities so that a proper regulatory framework can be made for the researchers, and the better therapies can reach to market and the patient, and cancer patient can survive for longer. Thank you so much. I'm open to questions.
Hello.
Hi, sir. Good morning.
Yes, good morning. Just I want to know whether you are pharmacology student or pharmacy practice student.
So actually, I did my MPharm project in pharmacology, but I am into the job. I mean, I'm working in the medical writing field already from last 10 years.
Okay. Okay.
But I did a project of MPharm in pharmacology from BITS Pilani.
Okay. No question from me. Thank you.
Thank you, sir.
Okay. So then I would like to go to Shomindu. Shomindu, are you there?
Thank you, everyone. Bye-bye.
Shomindu Mondol. Shomindu Mondol, are you there? I can see you in the meeting. Okay. So Shomindu Mondol, can you hear me with poster number 27? Yeah, we can see the poster. You can start presentation. But you are not audible. You are not audible, Shomindu. You are not audible. Your poster is visible. You are not audible. You are audible now.
It's not Somen, it is Tanmay. I resolved my internet issue. I want to inform.
Okay, so just wait for a few minutes so that Shomindu can finish it up. Then I can start your presentation. Just wait for a few minutes, please. Shomindu, can you hear me? If you are having some technical glitches, I can schedule your presentation at the end. You can stop sharing now. You are audible? You are not audible actually. Shomindu Mondol. Yeah, actually, Shomindu, please stop the sharing. Yeah, sure. Tanmay Chatterjee, you can start your presentation. Yeah, it's visible now.
Sorry. Good morning. Good morning.
Still, your voice is breaking. It's not coming clearly.
Tanmay, your slide is visible, but your voice is not audible.
Your voice is not there actually. We have to wrap it up this session as well, so we can carry these presentations, the rest of our presentations, in another link. I'll be sharing that link shortly because our renowned speaker from Thailand, Professor Farkung, he is waiting. He is already has joined the meeting, so I would like to open this forum for the next moderator. So shortly, I am sharing the link for the presentation. So thank you so much for being with me. I'm sharing the link in the group. So the rest other presentations. So we are left with poster number 26, poster number 27, 32, 33, 34, and Athira. Athira, if you are ready, then your presentation also you can give in that link. Okay, so thank you all. So I'm sharing the link and we are shortly joining in that link.
Sir, good morning, sir.
Good morning. Good morning.
Madam.
Hello.
Hello, sir. What is sir?
Yes.
Okay.
अच्छा चलो कि
So just 2 minutes from now, sir.
Okay, okay.
11:50
Okay, no problem.
11:58. Just
Okay, okay.
I think Professor
Yeah,
Farkum has also joined. Good afternoon, Professor Farkum.
Okay, a very good afternoon to all the dignitaries and guests present over here. Myself, Dr. Shushmita Patro, on behalf of the School of Medical Sciences, Adamas University, welcome you all to Technical Session 5 of second day of second International Conference on Transforming Ripples in Healthcare Research, Obstacles, Sustenance, and Cutting-Edge Innovations. The resource person of today's session is Professor Farkum, a professor in the Department of Pharmacognosy and Pharmaceutical Botany, Prince of Songkla University, Thailand, and you will be hearing a presentation on the topic Development of Herbal Products Using a Green Microwave Extraction. And herbal treatment has been practiced for a long time since ancient ages. With the current trend in the shift from allopathic medication to herbal products, the research and development with respect to the herbal products is on the rise. As the research in herbal products starts with extraction, therefore, exploration of advanced and novel extraction techniques is the need of the situation. So with this, we are deliberately waiting to hear from our speaker, Professor Farkum. And it is my great honor and pleasure to introduce our chairperson for this session, Professor Tapan Kumar Maiti, Professor of Department of Pharmaceutical Technology, Jadavpur University, and his specialization and research interest in the area of synthetic and natural product chemistry. In addition, he was a recipient of Professor Anupam Sengupta Memorial Bronze Medal for secured highest marks in M.Pharm Pharmaceutical Chemistry, Jadavpur University. He has published around 97 publications in various national and international journals. It is such an honor for us to have you today between us. Thank you so much, sir, for coming and bestowing us with your own presence. Now I am handing over the session to Professor Tapan Kumar Maiti for continuing the lecture from our resource person. Handing over to you, sir.
Good afternoon to everybody. Thank you, Ms. Patro, for introducing. It is a customary and responsibility of the chairperson to introduce the plenary speaker. And we are very glad that we have got a very genius personality today who will be delivering about 1 hour the cutting edge research. Actually, as already she mentioned that with the development or the momentum towards the herbal drug research as well as plant-based medicine in the current scenario, what Professor Farkhum will be delivering. So it is a most challenging job nowadays because we have seen so many toxic effects of the synthetic drugs. Last 100 years, we have already been observed that drugs are what obvious, but simultaneously they are very much toxic also. And in this century, I mean, you say the coming decades, I think more and more natural medicines, or so to say phytochemicals, will be coming in the purview. Already the phytochemistry and phytomedicines only to our former drugs from where the synthetic drugs has been prototyped or has been imitated. So nature is great, and we are waiting for Professor Farkhum delivery. So just I will introduce this great person in a very short. Dr. Farkhum is a professor in the Department of Pharmacognosy and Pharmaceutical Botany, Faculty of Pharmaceutical Sciences, Prince of Songla University, Thailand. His research interests involved development of herbal medicines using green extraction and standardization method, preparation of active constituent-rich herbal extracts and plant tissue culture. It is again a very vast area of recent research. His achievements include 108 publications indexed in Web of Science and 101 publications indexed in Scopus, with H index 19 as per Web of Science and 25 Scopus. Additionally, he has 12 patents. It's a great job that he has already achieved, and 14 petty patents and many international invention awards like Gold Medal Award and a special award for Seoul International Inventions Fair 2019, Gold Medal Award from International Exhibition of Invention of Geneva 2017, Gold Medal Award from Taipei International Invention Show and Technomart 2017. He has won many gold medals and 2 special awards from International Warsaw Invention Show and Silver Medal Award from International Exhibition of Inventions of Geneva 2018. He has many years of experience as a professor in Prince of Songla University, and has also worked as a head of the Department of Pharmacognosy and Pharmaceutical Botany. I think this type of specializations and the department also exist. Sometimes we are confused. Faculty of Pharmaceutical Sciences, Prince of Songla University. He has been recently appointed as Associate Dean for Academic Service of the same university and appointed as Director of Phytomedicine and Pharmaceutical Biotechnology, which is the hour of the days now, and Excellence Center, I mean Biotechnology Excellence Center, Faculty of Pharmaceutical Sciences, Songla University. So we shall be listening coming 1 hour or so to Professor Farkhum for his deliberations, and I will suggest the participants and other members, dignitaries, or those who are attendees, please have a very good look on the subject to be delivered today. With this, I welcome Professor Farkhum to deliver his speech. Thank you, Professor Farkhum.
Thank you very much. Can you hear me?
Yeah.
Yes, sir. Yes, sir.
Yes.
Okay. Thank you very much for your kind introduction, and thank you very much for the organizing committee that invited me to share my experience on the development of herbal products from green microwave extraction. Today, I am very pleased to share my research experience on the development of the product from ginger extract using microwave extraction. I think everyone may know this kind of plant called ginger in English. This plant we usually use for relief of nausea, vomiting, or upset stomach. And in Thailand, we also use for anti-inflammation, for pain and arthritis as well. The active compound of this plant, namely gingerol. 6-gingerol is the major compound of this group. This compound is belong to the group of phenolic compound. There are so many kinds of gingerol. For example, 6-gingerol, 8-gingerol, 10-gingerol, and another derivative, so-called sugarol. But the major active compound is 6-gingerol. For this compound, it poses many pharmaceutical activity, including anti-emetic, anti-cancer, anti-inflammation, and antioxidant. And nowadays, we know that 6-gingerol also has a benefit to protect against COVID virus, because from the in silico study, they report that 6-gingerol have inhibitory activity against main protease of COVID virus, and also inhibit RNA binding protein and spike glycoprotein. So this is the good news for us, that this compound may be developed, or it has the potential for prevention of COVID virus in the future. This compound now, if we buy from the market, it's very expensive, because only 10 milligrams is cost about $50 US. So we cannot use this pure compound for product development, because if we use the pure compound, the product will be very expensive. And recently, for the extraction of gingerol from ginger usually use acetone, but acetone is a toxic solvent. It can cause skin and severe eye irritation, headache, and nausea, vomiting. So, in my opinion, we would like to prepare the extract from ginger using clean solvent. So now we apply the clean technology or clean extraction for preparation of 6-gingerol extract from ginger. The basis of clean extraction includes 3 concepts. The first is use clean chemical or clean solvent for extraction, and the second is find for the extraction method that can save energy. And the third concept is related to the quality of the extract. We have to obtain the high quality of the extract that can be standardized. So in this case, we have to find the quantitative analysis method that can use for standardization of the extract. Today, I will focus 2 topics: the extraction by microwave method, because this method can reduce energy consumption, and how to find an alternative clean solvent.
Sorry for a short interruption. I think your slides are not visible. That means only cover slide we can see, but all the explanation you are giving, the slide is not visible. So,
but from my side, the slide have flow by my talking. How to? Now I come
yes,
to
sir.
this slide.
Yes, sir. Yes, sir. Now it is coming. Yeah.
But this is not slideshow. The slide will be small.
Yes, sir.
So when I show the slide, I click the slideshow. Can you
Yes,
see
sir.
it?
Yes, sir. Not showing the slide, so please kindly give the in this presentation mode so that we can see it.
So now I have the problem for slideshow from my side. How to, can I present by using this slide?
Yes, sir. Yes, sir. Now it is okay, but
It's not visible.
it will
It's
be
visible.
better, sir, if you make in a presentation mode. So it will be
Slideshow, slideshow, slideshow.
slideshow. Yes, sir.
Slideshow. Now we make
Yes, sir.
slideshow.
Yes,
Is
sir.
this okay?
It's okay. I think.
It's okay. Okay,
Okay,
sir.
okay.
Okay, sir.
Please,
Now
please, please,
the
you
slide
continue.
is full.
No, it's visible, very nicely visible. No problem.
Yes, sir.
Is this okay now?
Yeah,
Yes,
yeah.
sir. Okay, sir.
Okay. So I got to further slide. Can you see the next slide?
No, sir. Next slide is not visible now.
Because I already changed.
Now
Yes,
it's
sir.
changed. Maybe a little slow.
Yeah.
Now
This
it is
slide
changed. It is changed. Okay.
Now is this okay?
Okay, sir.
I'm
Okay,
not
sir.
sure for
Yes,
the next
No,
slide.
it's okay. It's okay. It's okay.
So today I will focus on microwave extraction, because microwave extraction is the method that has been proved for as the green technology for extraction of herbal medicine. Can you? I already changed the slide. Can you see it?
No.
No.
No, sir.
So I think I have to
Now it is
go.
changed. Yeah.
Go and back. Is it changed?
Yes, sir. Yes, sir.
Yeah.
What happened? Okay, I will tell why microwave extraction is safe energy, because the heat, the heat that generated from microwave is not come from the electricity directly. It come from microwave when the compound that have dielectricity exposed to the microwave. Exposed to the microwave field, it will have two phenomena. The first is ionic conduction, and the second is dipolar rotation. These two phenomena will generate the heat from this interaction. So the plant cell contain many compounds inside, both polar and non-polar compound. For the polar compound, when it exposed to the microwave, it will have vibration or rotation, and it will generate heat. So the heat is generated from inside the cell, and the pressure inside the cell will be higher when the heat produced. So the cell wall will be broken and release phytochemical from inside the cell. From the literature review, when they compare the heat produced by conventional heating compared with microwave heating, we found that the microwave heating will give higher temperature than the conventional heating by oil bath. And you see the temperature inside the oil bath, inside will be lower temperature and outside will be higher temperature. But for microwave, the inside will be high temperature, but outside will be lower temperature, because the microwave generate the heat from inside the cell. So for conventional heating, we will lose the energy or temperature to the container. So you heat what you don't want to heat, for example, container, because outside will export directly to the heat. So we lost energy to the container. But inside, we would like to break the cell, the plant cell by heating, but inside will be the temperature will be lower. On the other hand, microwave irradiation, the sample inside will be produce higher temperature from vibration and aerotic rotation. So it will be produce higher temperature inside than outside. So in this case, the less energy consumption by this technique. The other strategy to produce the herbal extract using green extraction is to find an alternative solvent. Excuse me, can you see this? I changed to the new slide. Can you see it?
Sir, no, sir.
So I have to use the same.
Now it is changed.
So go and back.
Yes, sir.
So another strategy is the find for alternative green solvent, and we have success. I will show you an example that we find alternative green solvent from pharmaceutical excipient. For example, I use pharmaceutical excipient for extraction of alpha mangosteen from the polycarp of mangosteen. This compound is non-polar compound, and we would like to prepare it at the product. We would like to develop the product as the anti-acne cream because this compound have antibacterial and anti-inflammation and wound healing. So we would like to produce anti-acne cream. I use the cream base, the composition in the cream base that have non-polar property to extract the compound alpha mangosteen from the plant powder. So we have a success to extract using cetyl alcohol. Cetyl alcohol is the pharmaceutical excipient that act as stiffening agent in the cream base. So finally, we get the extract in the form of solid, because cetyl alcohol is solid, but it can be melted in microwave condition, and it will act as the solvent, alternative green solvent for extraction of alpha mangosteen. Alpha mangosteen have yellow color. So because it is the xanthol derivative, it has yellow color. So the extract have yellow color. And if we use this extract, we do not need to perform the solvent evaporation, because we can use this extract directly for formulation of anti-acne cell. We can get 2 in 1. First is cetyl alcohol, because cetyl alcohol cannot evaporated, and alpha mangosteen that we can use as the active compound. So for this extract, we get both cetyl alcohol and alpha mangosteen, and we can use it directly for formulation. So we can skip the step of solvent evaporation. Then we can reduce the cost of production, because we do not need to use the energy for evaporation. No need to use the labor to take care of this step. So this kind of extract can reduce the cost of production. So today I would like to share another success for extraction of sick ginger. We would like to prepare the product from sick ginger extract as the pastille. So first we have the target. for the formulation at the passive, then we find an alternative clean solvent. We find the alternative clean solvent from the passive. But we have to find the formulation of the passive base, that what is the composition in the passive base that we can use them as the alternative clean solvent. And we find that glycerin is one of the pharmaceutical excipient that we can use it as the alternative clean solvent for extraction of 6-gingerol. Another compound is the mixture of sucrose and citric. Sucrose and citric acid is the eutectic mixture. When they mix together, the mixture will reduce the melting point. The melting point of the mixture will be reduced. So we can use this eutectic mixture as an alternative clean solvent. So in our project, we select glycerin and eutectic mixture or sucrose and citric acid as the alternative clean solvent for extraction of 6-gingerol from ginger powder. So we start from optimization of the microwave condition for extraction of ginger powder using glycerin or sucrose with citric acid. And after that, after we get the optimized condition, that then after filtration, we can get the extract from the glycerin we call GE, and from the eutectic mixture we call EMSC. And after we get the extract, we go to, it will be subjected to HPLC analysis for determination of 6-gingerol. So for the optimized microwave condition, we optimize the power to solvent ratio, microwave power, and the time for extraction. Finally, we got the suitable microwave condition for extraction, and the obtained extract are subjected to quantitative analysis of 6-gingerol using HPLC. And after determination, we found that both of them contain 70 milligram of 6-gingerol, 70 milligram per gram of gingerol. So we can standardize the content of the active compound in the extract. After we got the extract, we determine the anti-emetic activity using the ex vivo or the section of ileal and the lower esophageal sphincter, and perform the pharmacological activity by determine amplitude of ileal contraction and tone of contraction of LES. For the first experiment, we determine the cholinergic receptor assay using the cholinergic receptor assay by determining the activity of muscarinic-3 receptor antagonists using organ bath, and put the ileum section in the organ bath in cap solution. I think I forgot to show you the PowerPoint. And by this condition, we use carbachol for stimulation of the contraction, and use 6-gingerol, the pure compound, and the extract, 2 extract from ginger and 2 negative control using the solvent for extraction, glycerin, and eutectic mixture, and the positive control use atocarbene. Atocarbene used as the positive control. So by the pharmacological activity determination using cholinergic receptor assay, we found that the M3 receptor antagonist activity of 6-gingerol is different from the positive control atocarbene. Atocarbene have this effect by competitive inhibition, but 6-gingerol show this activity by non-competitive inhibition. And also the extract from using glycerin and the extract using eutectic mixture also show the same activity as the pure compound 6-gingerol. But when we see the concentration, we found that at 0.5 milligram per milliliter of the extract contain almost 29 micromolar of 6-gingerol, and 0.5 milligram of this extract also contain 29 micromolar of 6-gingerol, and it equivalent to the concentration of 6-gingerol at 30 micromolar, but the activity is much higher because it can inhibit the receptor more potent than the pure compound. So if we use the extract in the form of green extraction, we can get higher activity than the pure compound. Another assay for anti-emetic activity is we use serotonin receptor assay. The assay are almost the same as the muscularity assay. So we use the organ bar and ileum section in this and stimulate with. Can you see it? For serotonin assay, we use serotonin for stimulate the contraction of ileum, and we also use the sample in the same as the previous study. And the result also show the same. The inhibition of the control or densitone is the positive control for this assay. It show competitive inhibition. But for 6-gingerol and the extract also show non-competitive inhibition. And also at the concentration of 29 micromolar in the extract, it show higher inhibition than the pure compound. And another pharmacological activity that we use for determination of anti-emetic of our extract is LES responsiveness assay. So in this assay, we determine the contraction of LES or lower esophageal sphincter. We use sodium nitroprusside to make the sphincter relax, and then we treat with our sample in the same as the previous study and check the contraction of the sphincter. And the results show that only gingerol and the extract from using the eutectic mixture tend to increase LES tone, at the modern duct, metoclopramide and carboxyl. This is we use as the positive control. So in conclusion, can you see? I forget to show you the slide because now it have some technical technique. This is the result of the inhibition, stimulation of aldosterone. And in conclusion, we get the microwave condition for extraction of 6-ginger from ginger powder by a very simple method. We put powder with solvent together and put in the microwave for half an hour. And then after fermentation, we got to extract the extract from glycerin and the extract from eutectic mixture. And both extract contain 17 milligram per gram gingerol after standardization. Oh. And then we determined pharmacological activity, and we found that these extracts can inhibit muscarinic 3 receptor and serotonin 3 receptor. And we can use this product after standardization for formulation of pastille. So in this process, it use very low cost, but we can get the high quality product. So now we can apply for the patent in Thailand for the method of preparation of 6-ginger extract using alternative green solvent, and also apply for another patent for the formulation of pastille made from 6-ginger extract. This is the thesis of my PhD student. So now she planned for graduate after submission of the manuscript and publication. And also we have another co-researcher from Faculty of Science, Dr. Pisalet. She helped me for determination of pharmacological activity. And this project, we got the research grant from RGJ PhD scholarship from the government. Thank you very much for your kind attention. Are there any questions? I'm sorry for some technical technique because I cannot fold my slide smoothly. Is there any question from the audience? Can you understand my talk?
So thank you very much, sir, for your nice and very informative presentation. So, thus I am requesting to all the participants that if you have any question, you can put your question in the chat box. So I will read the questions on behalf of you.
Thank you, Professor Farkhub. This is Partha. Thanks, you are able to make it at the last. We are very happy to have you amongst us.
Thank you very much.
Okay.
So I think participants are not putting any questions. So
okay.
One question from my side. Actually, sir, I am interested to know about what is the advantages of this green microwave extraction in respect of percentage yield. That is, it is advantages of another method of extraction process that we can get a more yield by using this process.
Yeah. So for microwave extraction, the advantage for the the yield of the active compound is this method usually use short time for extraction, and then the compound exposed to the high temperature in short period. For example, we extract the 10 kilogram of ginger using the microwave. The capacity of extraction is 50 liter. So we use only half an hour for extraction. But when we use the conventional method, for example, reflux, if you extract this size or this scale of extraction, it will consume not less than one day for extraction in this scale. So you will see that the time that compound exposed to the heat when extraction with microwave is very short, only half an hour, we can finish extraction. So the compound, most of compound, natural compound, when exposed to heat for a long time, it will be decomposed. That's why extraction by microwave usually produce higher yield of the active compound than the other conventional method that use heating. And another advantage is the method is very simple and use very short time, so we can reduce the cost of production because we can reduce much energy use, energy consumption for extraction. When my microwave extractor have a meter, electricity meter, to determine how many units we use for extraction. In this case, we use only 2 units of electricity. That cost only $0.3 for electricity consumption. So the cost of production will be lower than other methods.
Okay, thank you, sir. Thank you so much. I have another more question, sir. So that you have discussed regarding the during the microwave extraction method, the inside molecules is get more energy, or it producing more heat compared to the outer side. So
Yeah.
I want to know that the phytoconstituents, so they are so much thermolabile, so most of the phytoconstituents, so that we are keeping the minimum heat and doing the conventional extraction procedures. So if in case of microwave extraction, if the inside the molecule it is getting more heater or consumption more energy inside, so what are the disadvantages if you are want to isolate any phytoconstituents that are potent in nature, but it is any possibilities there that it will be destruct during this extraction process?
No, we can control the temperature because we have to check the temperature during extraction. We usually control the temperature not more than 80 degrees Celsius when we use organic solvent. For example, when I extract using ethanol, we control the temperature not more than 80.
Yes.
If the temperature is around 70 to 75,
yes.
Yeah. So the temperature we can control, and the time for export to the temperature is very short. So the more phytochemicals still stable, and more stable when we heat it with reflux, because the high temperature and very long time, more than 1 hour. So the compound will be more degradation.
Okay. Thank you, sir. Thank you so much, sir, for your answer. Okay. Till there is no question from the participants. So
okay. So
I have a small, just a small suggestions from my side for Professor Fakum. Professor Fakum, we in our faculty we have a lot of persons working on drug delivery of different phytochemicals. or delivery rather of different phytochemicals, maybe for improving their bioavailability or permeability or stability. So as you are an expert, globally renowned expert, and you have a lot of isolated products, maybe we can send you an invitation to just, if you can, we can collaborate and we can do something on the formulation part of these products, maybe the novel formulations like nano or liposomal formulations on this product.
Yeah, very welcome.
Thank you. Thank you.
Okay. Okay, thank you very much to give me a chance to share my research experience, and I'm very welcome to make the collaboration for further research. Thank you very much. I have to leave now because I have another work.
Okay, sir, please, sir. So now I am requesting Pratibha Madam to share a certificate of gratitude to Professor Farkum.
Thank you very much.
Sir, this is a small token of gratitude from us for your nice presentation and for your timings to have with us. Thank you so much, sir.
Okay, bye-bye.
Bye.
See you later.
Have a great day, sir. Now I am requesting Pratibha Madam to sharing the certificate to Professor Tapun Kumar Maiti.
Thank you.
Sir, this is a small token of gratitude from us for your presence over here.
Yes, it's my pleasure. It's my pleasure because I visited your institute few times also. I mean, in different academic work, I think. So Professor Farkum has already left, no? Actually,
yes.
Participants, they could make some more questions. Anyhow, he has already left. Then already he has narrated. No? So your next slot, I think, other lecture is there, I think.
Yes, sir.
So
after the post-lunch session. So with the permission, so I ended this session. If you give me permission.
No problem. Please carry on. Thank you.
Thank you, Professor Maiti, sir. Thank you.
Thank you, Professor.
Thank you for joining and giving us the time, sir.
Thank
you very much. Thank you very much.
Thank you, sir.
Bye. Thank you.
Thank you.
Thank you, sir.
Okay, so with the permission, now I am ending the session. So all the participants, stay tuned because we are resuming shortly after post-lunch session. We have a renowned speaker from different countries, and please stay tuned.